Hi there.
Hi.
Sorry about the long wait. Okay. I see you're reading a book.
Yeah.
What is it called?
How to meditate?
Wow. I've read this book actually.
Oh, yeah.
Pima Chodron. She's definitely an inspiration.
Mm.
Thanks for sharing that. Oh, goodness. I don't know what Jackson's been doing, but everything is a mess these days. I'm just gonna grab an intake form. Where did it go? Let's see. Okay, got one over here. All right. Okay, so it looks like I have some information here, but not very much. Your name is, are you nervous or anxious at all?
Just a little bit.
How come?
I'm not used to intake forms, doctors asking me personal questions.
I can understand that, especially since you're a new patient and I'm a stranger. Maybe I can offer you a little teddy bear to keep you company.
Thank you.
You're welcome.
Does it have a name?
Yeah, I call him Boo Boo Bear. He's been sitting on my desk for a while.
I like that.
But you can keep him if you.
Really?
That'll make you happy. Yeah,
Oh,
for
thank
sure.
you. Thanks.
No problem. So, Marika, is it? How do you pronounce your name?
Malika.
Marika? Okay. All right. So it looks like you are here for a head-to-toe assessment. Are there any health concerns that you have?
Well, in 2017, I had IBS. I still have it. It's not as bad. And I have really bad time of the month cramps and migraines.
Menstrual cramps, Did all of that start in 2017?
Yeah, my post-secondary school was very competitive and I was really stressed out. I think that was the main cause of that.
Thanks for sharing that. I can imagine it must have been really difficult. We'll do our best to help you here, and we'll definitely have that information, whether it's through physical exams or through lab tests and whatnot, to try to figure out what's happening in your body and what could be contributing to your cramps, your migraines, as well as your IBS. Okay? What are your stress levels like nowadays?
Work's not that bad,
Okay.
but there are times where I definitely feel the anxiety approaching and the stress.
And how would you rate it from 1 to 10, 1 being very little stress and 10 being the most stress you've ever felt?
I would say about a 4.
Right now? Okay.
Which isn't too bad, but there's definitely still a bit of stress.
Okay. And what is your job?
Oh, I'm a receptionist. I work part-time. I'm nothing like Stacy, don't worry.
You heard about Stacy, huh?
I did. Sorry about her.
Yeah, that's okay.
And the other half of the day, I'm a elementary teacher.
Very cool. So stress level is 4 out of 10 right now. Are your IBS symptoms, how are they now compared to back in 2017 when they first started?
I've been on a pretty good diet. My best friend's helping me a lot. And I wouldn't say my IBS is regular. Occasionally, when I go off my diet, it happens.
Mm-hmm.
And I think that's my body telling me that there are certain foods I must avoid.
Mm-hmm. What kinds of foods?
Anything too rich, too creamy, fatty, oily.
Mm-hmm. Have you experimented with taking certain foods out of your diet, like dairy or gluten or anything like that?
For sure. I became gluten-free recently, and that's helped a lot. I'm also lactose intolerant, and I completely cut out any milk, and that helped immensely.
So any dairy products? Okay. Have you seen any other practitioners, an MD for this, or perhaps any other practitioners like homeopath or traditional Chinese medicine doctor or anything like that for this condition?
Not for this condition. I went to a doctor about this, and he didn't really give me the best advice. So when I found out about you and your practice, I was really intrigued, and I wanted to try it out.
Oh, thank you so much for coming. So yeah, we practice naturopathic medicine. Do you know a little bit about that? Yeah, so with naturopathic medicine, we kind of combine conventional medicine. So we do the physical exams, the diagnoses, we order tests and all of that. But on top of that, we also practice other medicines like traditional Chinese medicine, acupuncture, botanical medicine, and we also have a very big focus on diet, lifestyle, and counseling. So we try to take a holistic approach and really put the patient first and create a individualized treatment plan for each patient.
That sounds incredible. Wow.
Thank you. All right, so hopefully we're going to be able to help you out with all the health concerns that you have brought up today. All right.
Thank you.
Is there anything else you'd like me to know before we begin our physical exam?
Oh, I had lower abdomen surgery in 2018.
Okay. Okay, so I do have some of your medical history here from your medical doctor. So I see that you had a inguinal hernia surgery. Okay. And are you taking any medications or supplements? It looks like here only naproxen. Are you taking that currently?
Yeah.
Okay.
For my menstrual migraines.
Okay.
There are days where it gets unbearable.
Okay. Any other medications or supplements?
No.
No? Okay. All right. Just looking at what other things might be helpful. We can also dig into this a bit more in our next visit as well. What are your energy levels like these days?
They're pretty good. I'm not too stressed, but I do feel myself getting pretty tired after work. Sometimes I'm not able to enjoy like going for nature walks or seeing friends because I'm so burnt out.
So you do feel burnt out. Okay. Do you feel that you have enough energy during the day?
Yeah, I would say so.
But you get tired when you get home?
Yeah.
All right. Okay, and I'll ask you some more questions about your digestion and whatnot when we get to the abdomen exam. Definitely want to explore that a bit more. So let's talk about your sleep. How easy is it for you to fall asleep? Rated out of 10, 1 being very difficult, 10 being very easy. How would you rate it?
Oh, a 10.
A 10 out of 10.
Anybody who knows me, I fall asleep pretty quickly.
That's really amazing. Definitely envious of you in terms of that. I do have trouble sleeping, probably because of my profession. But, you know, it's been better than before. So, anyway, enough about me. Do you wake up in the night at all?
Sometimes. It's funny, I can sleep really quickly, but noises like a door opening and closing, I'll wake up to, and that will interrupt my sleep schedule.
Okay. How often do you think you wake up during the night?
On a good night, 2 to 3 times. On a restless night, 4 to 5.
Okay. Do you feel well rested in the morning?
If I get 10 hours of sleep, yes. If I don't, it's really hard for me to function.
I see. If it's less than 10 hours, then you have difficulty functioning normally?
I do.
Okay. Do you have dreams?
Yes.
Some of this information is also helpful for traditional Chinese medicine, which I really enjoy practicing. Do you nap during the day at all?
I used to a lot, but then I wanted to appreciate each and every day, so I tried to stay up as much as I could and then just sleep earlier if I was exhausted.
Okay. And how has that been working for you?
Right now, pretty good. I like it.
Okay, great. What time did you say you go to bed?
Pretty early, around 8:30.
Amazing.
Well, I live really far away from work, so the commute is over an hour. So I have to go to bed pretty early.
Yeah. And what time do you wake up to get to work?
6.
6 a.m. Okay. Okay, so that's about 9.5 hours of 9.5 hours of sleep. Does that kind of work for you?
Yeah.
Okay. All right. And I'll keep asking you questions throughout the exam, but I do want to get started so I'm not super late for the other patients.
Okay.
Let's continue. Okay. Right. Just move these flowers. Okay, I'm just going to take your temperature. I'm going to place this under your tongue. I want you to just hold it with this hand over here, okay? In the meantime, I'm just going to take your pulse. Perfect timing. Okay, great. 74. Okay. If you don't mind, can you take off your jacket?
Sure.
Just going to take your blood pressure.
Okay.
Sorry, I don't want to get your hair caught in. I'm just going to move it to the back. Okay, good. Sorry, 1 second. Can you please raise your hand all the way up and pump your fist 10 times? Your blood pressure is 100/55. If I may ask, are you quite athletic?
Yeah.
Yeah, I thought so. Very impressive blood pressure. Do you ever get low blood pressure symptoms? Like, do you get up and, get dizzy, or your vision goes black? Any of that?
Sometimes if I'm lying down for a long period of time and I get up too quickly, I get a bit dizzy.
Okay.
That's about it.
Okay. How much water are you drinking every day?
Not enough.
Not enough? How many glasses would you say? Let's say if, how many of these are you drinking every day, would you say?
One.
Only one? Okay.
I'm really busy with work and I forget to drink water. I know that sounds so silly.
No worries.
I need to definitely try to drink water.
Yeah, I would definitely, what size is your water bottle?
It's just a little bit bigger than yours, about that big.
Okay. I would encourage you to start with drinking 4 of them. I know that seems like a lot, but start with 4, and then we'll see from there.
Okay.
Okay. Okay. Okay, Marika, so I would like to do a scalp check as well as a skin exam, if that's okay. All right. Do you mind just scooching a little bit closer? Okay, thank you very much. Okay, so let's take a look at your scalp. Okay. I'm just looking to see if there's any indication of lice or nits. Also looking for any nevi, so any moles on your scalp, as well as any kind of irritation or infection, inflammation of the skin. It's all really important to take note of. Your hair looks really healthy, so that's good. It does also tell me quite a bit about your nutrition status, as well as your hormone status. Okay. Any issues at all with your scalp or your hair? No. Okay, great. So now let's take a look at your skin. Okay. Okay. Take a look at this side here. Okay. All right. I'm just going to take a look at your legs as well. Oh, did you fall somewhere here?
I did. I was playing soccer with my students and I fell on some grass.
Oh, I'm sorry to hear that. Seems like it's healing quite well, though.
Yeah.
Okay, good. It doesn't look like you have excessive bruising or anything like that. And I haven't noticed any lesions in your skin, no inflammation, no redness. I haven't noticed any suspicious moles either. So that's really good. Do you have anything concerning about your skin that you'd like to let me know?
No.
Okay. Just take a few notes here. Oh, I realized I forgot to take a look at your nails. Let me make sure to do that carefully and also check for capillary refills so we can see if there's any vascular issues. But now you're doing really well. And I don't see any pitting of your nails. I don't see any signs of infection or anything like that, so that's really good. Do you mind if I take a look at your toes as well?
Yeah.
Let's take a look here. It does seem a little bit cold. Okay. Okay. Looks great. Wonderful. Okay, Marika, so I'd like for you to place your hands together like this and pull on them and count from 10 to 1, okay? 10, and so I want you to count.
Oh, sorry. 10, 9, 8, 7, 6, 5.
All right, looks like Yeah, I actually have the same exact problem where no one can get a reflex out of me because I just can't seem to relax my leg, and it's totally okay. I don't, I'm not suspecting any neurological issues with you, so don't worry. I'm just going to check for that one. Good. Good. Those reflexes are intact. Okay. All right. So we're just going to do some tests with your eyes, okay? So I want you to just look straight ahead. Okay. All right. All right. Just going to check your pupillary reaction. Great. Wonderful. Do you wear glasses, Monica?
I do.
You do? Okay. And are you wearing any contacts right now?
No.
No? Okay. I will go ahead and not do this test because we'll have to do it with your corrective lenses on. So if you do have any issues with your eyes, I would just make a referral to an optometrist for that, okay? So we'll skip that part. I would like to check your peripheral visual fields. So for this test, I want you to cover this eye, this one right here. Okay, and I want you to look straight at me in this eye. So turn around to face me, please. Thank you very much. All right, and I want you to look directly into my eye over here, okay? Don't let that eye move at all. And I want you to let me know when you see the fingertips, the wiggling fingertips. So if you see my fingers, it doesn't count. Only when you see my fingertips does it count, okay? So you just let me know when you see it.
I can see it.
Okay.
I can see it.
Try that again. So you have to come up a little bit closer. Okay.
I can see it.
Good. Trying to find an area where my eyes cannot see it. Okay.
I can see it.
Good.
I can see it. I can see it. I see it.
Oh,
Oh, sorry.
it's okay.
I see it.
Good. So I want you to switch eyes. Okay.
I see it. 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 I see it.
Okay, great. Okay. Now I'd like you to follow the tip of my pen, all right? Yeah. Now I'd like you to follow the tip of my pen. This is called the H test. With just your eyes, don't move your head. With just your eyes, look at the tip of the pen, okay? Follow the tip of the pen. Good. Great. Wonderful. don't see any signs of nystagmus. Okay. There's just one more test I'd like to do with you. So I want you to again look at the tip of the pen, but then look behind me at the wall there. Back at the pen. Actually, sorry. I'll do it this way. Look at the pen, and then behind the wall. Back at the pen, behind at the wall, and keep looking at that pen. Good, very good. All right. So for this exam, I'm going to be taking a look inside your eye, actually at the retina, as well as the optic nerve, which is really cool. And this is going to show me if there are any issues with like the pressure in your eyes, if there's any issues with the blood vessels, or sometimes it can also pick up things like diabetes and also infections and that kind. So I'm just taking an overall look. All right. So again, I want you to just look at that curtain right there and just keep looking there. Okay. How's your eye? Good. It's okay? All right. Just going to give that eye a bit of a rest. I'm going to move on to the other eye. Just going to look at this eye just one more time, if you don't mind. Great. I don't see any issues at all. Your optic disc looks great, your retina, all the blood vessels, there's no issues of hemorrhaging or nicking or anything like that. So yeah, looks like your eyes are really healthy. Okay, Monica, now we're going to be testing your hearing. I'd like for you to close your eyes. Close your eyes. And I'm just going to plug this ear right here, okay? And I want you to let me know what you hear. I'm going to whisper a 2-syllable word, okay?
Pumpkin.
Great. Polar.
Polar.
Yeah. I wanted to say polar bear, but then I noticed that was in 2-syllable words, so I said polar. But you got it. Perfect. Okay. So now we're going to be doing a hearing test. I'd like for you to let me know if you hear the sound on both ears or only on one side, or if you hear it on one side before the other. Okay. Okay. Do you hear on one side before the other or at the same time?
Around the same time.
Do you want me to try again?
Yes, please.
Okay. Different times or the same time?
The same time.
Okay, great. Now I'd like for you to close your eyes again. Just going to move your hair back if you don't mind. And I'm going to strike the tuning fork, place it on your mastoid process back here behind the ear. And I want you to let me know when you stop hearing the sound, and then when you hear it again, and when you stop hearing it again. I'll guide you through it.
Okay.
Do you hear the sound? Let me know when you stop hearing it, okay?
Okay, stop. Okay, I can hear it.
Do you hear it?
Yeah.
Okay. Let me know when you stop hearing it.
I can't hear it.
Okay, great. Okay, same drill. I want you to close your eyes, please. Do you hear this?
Yes.
Let me know when you stop hearing it.
Okay, I can hear it.
Do you hear this?
Yes.
Let me know when you stop hearing it.
I can hear it.
Very good. Any pain?
No.
Any pain?
No.
Any pain?
No.
Alright. A little bit of serum and the tympanic membrane is perfectly intact. Cone of light is present. And to your inner ear is a little bit of inflammation. A little bit of vasculature. Have you ever had an ear infection before?
I did when I was really little. 2 years old, I had a really bad ear infection. But since then, no.
Okay. Alright, it's good to hear. Any pain back here?
No.
Any pain here?
No.
And what about like this?
No.
Good. Let's take a look at it. well as the tympanic membrane. But the cone of light is still present. I see the bottom landmarks. Have you ever had any issues with this ear?
No.
Have you ever cleaned it out a bit too far or anything like that?
I stopped using Q-tips when my sister had a really bad ear infection after using Q-tips, so I don't.
So not recently?
No.
Do you mind if I take a look again?
Yeah.
Okay. No active signs of infection, but it does look like there might have been something there before that left a mark, possibly from your old ear infection. There's quite a bit of redness, more so than the other ear.
Oh.
I wonder if this is the ear that had an ear infection in the past that was pretty bad, and it left a little bit of inflammation, some scarring in there as well. Yeah, but otherwise it looks great. There's no active signs of infection. The tympanic membrane is fully intact, and there's no bulging, there's no cloudiness or anything like that, so it looks really good. Yeah.
Thanks.
Is it okay if I continue the examination of the face? A few things I want to check for. If you could look up for me. Great. No signs of anemia or jaundice there. Great. Okay. Very good. No signs of inflammation. I'm going to take a look in your throat as well. So I just want to take a look inside your throat. If you could please just open up your mouth and say ah, ah. If you could just let your, oh perfect. I can see your tonsils just fine. Great. Just one more time. Ah. Okay. Is it okay if I use a stick to examine your teeth and your gums?
Yeah.
Okay. Just open up your mouth. I'm just going to slide this right in. I know it's a little bit uncomfortable. Okay. And just down here. Good. And if you could just raise your tongue up to the roof of your mouth. Okay, great. Sorry, I know it's very uncomfortable, but it looks like your gums are in great condition, and as well as your mucous membranes. I didn't notice any ulcers or anything like that. And it looks like your teeth are in great condition as well. I do want to just look at the top of your teeth quickly. If you could just open up your mouth. When's the last time you went to a dentist?
I've had 3 dentist surgeries in the past year, so quite a few.
Okay, I see. Open your mouth again. I do see one of your molars in the back here, the third last, the second last molar back there. It does have a little bit of a dark spot, and it doesn't look like it's food or anything, so it might be a good idea to get that checked with your dentist. See if it might just be like a cavity in the surface or something.
Okay.
Sorry to alarm you about that, but it's a good idea to maintain your oral health so that the infection doesn't go anywhere else in your body and doesn't exacerbate anything, okay?
Okay.
right.